Hello, my name is Joshua Brumberg. I'm the Dean of the Sciences here at the Graduate Center, and it's my pleasure to welcome you in person or online to the first of two City of Science events this spring. Tonight's event is entitled Our Collective Mental Health. Through this evening's discussion, we will explore a variety of mental health issues and how the pandemic and its ebbing have impacted our mental well-being. As a public university, the Graduate Center and its associated Advanced Science Research Center are committed to the idea that our scientific research has a role in advancing the public good. To help us understand mental health, I am joined today by three outstanding clinical scientists. And starting from my left, I guess to your right, if I transpose correctly, we have Dr. Tracy Dennis-Tiwary, who is a professor of psychology at Hunter College and the Graduate Center. She studies the neural basis of teen anxiety, youth risk for suicide, the impact of technology on social and emotional well-being, and novel digital therapeutics for mental health. She has served as an advisor for media outlets such as ABC and as a consultant for the New York City Department of Education and for the digital wellness organization Global Day of Unplugging. To her left is Dr. Ana Ortin Peralta, who is an assistant professor at the School Clinical Child Psychology Program at Furkhoff Graduate School of Psychology, Yeshiva University, and an adjunct clinical assistant professor at the Psychiatric Research Institute at Montefiore, Einstein. Her research program uses a mixed methods approach to examine how development, culture, and context interact to increase suicide risk among children and adolescents from diverse backgrounds. Her research also focuses on identifying psychologic pathways underlying the intergenerational transmission of suicide risk. And finally, on the far left is Dr. Regina Miranda, who is a professor of psychology at Hunter College and the Graduate Center. She is the co-director of clinical training for our health psychology and clinical science psychology doctoral training area, and heads the laboratory for the study of youth cognition and suicide. Her research focuses on understanding why young people think about and attempt suicide in a way that can inform assessment, treatment, and prevention of suicide risk. Finally, a few words about tonight's event and how it will unfold. I will lead our panelists in discussion, and I am sure many of you will have questions, which I invite you to ask during the latter portions of our event. I'll tell you once now and remind you at the end to please come up to the microphones located on either side of the stage so those online can hear your questions as long as the response. All right, so without further ado, I thought we'd start very simple and ask the panel, when I say mental health or mental well-being, what does that mean to you?
I'll jump in. You know, as a mental health professional for more than 20 years now, that's a lot of years. You know, when I think mental health, I actually start by thinking of how I used to think about it. When I said the words mental health, I thought about mental illness, and just really simultaneously. And now when I think about mental health, I think about skills that we need to build, that mental health isn't an endpoint, it's a process. I think it's perhaps in some ways more similar to fitness than it is to a disease state in many cases, not every case, especially when it comes to serious and severe mental illness, the disease metaphor holds. But I really think about mental health as something that we can build skills with gradually over the course of our life.
Either you want to add to that?
I would like to add that mental health doesn't mean to be doing okay all the time. Mental health also means that you are gonna, that we might go through hard times and even harder times and better times, but we are able to find a way to deal with those times and then put ourselves, into a better place. But yeah, it doesn't mean the absence of any problems or any suffering.
And I would just add that it also relates to how we learn to navigate our emotions, how we're feeling, and that it's a continuum, and that we all lie on various parts of that continuum in terms of how we manage our feelings, how we manage our relationships, and our other aspects of our lives. Also that it's impacted, it's not just about what we're thinking and feeling, but also how we react to the environment around us. And oftentimes we focus on what we can do to change our quote-unquote mental health functioning, but not as much on how the environment can change to help us feel better.
That reminds me of some really classic older psychological thinking by thinkers like Erich Fromm, who wrote the book The Sane Society. And he really defined insanity in the context of a society and whether or not it supports what he defined as mental health, which was the ability, in a nutshell, the ability to love, to tell the difference between truth and falsehood, to create and to have a sense of your own agency. And so I think I really want to echo what Dr. Miranda said, that it's not just inside the individual, but it's also this fit with the environment and the changes that can support or compromise our ability to work towards mental health.
Well, we went through what is hopefully a once in our lifetime event with the pandemic, and it's certainly almost impossible to listen to the mainstream media each day, and they were talking about how the pandemic was affecting mental health. Did you see things as mental health professionals that the pandemic had exacerbated?
I think it depends, and I don't think that there's one answer that captures everyone's experience. I think data from epidemiological studies and big systematic reviews might suggest that the pandemic had a minimal impact on our mental health. So there was a recent study that's received a lot of press led by the corresponding author, one of my friends, Brett Toombs at McGill, that looked at data from high-income countries from North America, Europe, Asia, but primarily high-income countries, suggesting that the pandemic had not much impact on mental health, with the exception of women who had slightly higher depressive symptoms, parents, LGBTQ+ populations, university students. But it didn't really delve in. That's not the complete story, because it really didn't delve into, first of all, lower income countries and populations tend to be underrepresented in those data. Racial and ethnic minority populations tend to be underrepresented generally in our mental health research. And so I think it depends on the circumstance. For some people, and then where in the pandemic we've been. So early in the pandemic, there was a lot of concern about the lockdown and the measures that were taken to mitigate the impact of the pandemic and its potential impact on mental health functioning. When in fact, in my area where I study suicide, some of what was happening during the pandemic for some people might have led to actually improvements in how they were feeling and how they were functioning. So some people, for example, in their social environment was causing stress. So not having to navigate those stressors in the short term might have improved how they were doing. People who, kids who in school experienced the impacts of systemic racism or discrimination or bullying or other, things that might impact their mental health functioning, being removed from that environment and going virtual might have been helpful. For some people who got there, that was part of their, where being in school or being at work or socializing, right, it was something positive. Not having that may have negatively impacted their mental health functioning. You know, parents being more present at home. In some cases, parents were more present at home and they might have been able to watch out for their kids for mental health problems that they were experiencing. But other parents were essential workers and didn't have the luxury of being able to stay home with their kids. And so for families who experienced economic strains, that has an impact on mental health functioning. And so that's at the short term, and then we look back, and then we have to look at long-term outcomes, right? So having this chronic stressor, what does it do now that you're going back when the narrative is, okay, well, things might be okay, we're acting as if things are okay in terms of the pandemic, but we're not quite sure. You've had to be hypervigilant to getting sick. There have been past losses, and so I think it really depends on when in the pandemic we're looking at things and who we're looking at Sorry, I went on for a bit
Oh,
long. Apologies.
that's great. Do any of you want to follow up on that?
Well, I would just add briefly about anxiety, which is a focus of mine, just really echoing what Dr. Miranda said, that, if we track this progression of mental health indices, over the pandemic, during lockdown, a lot of anxious kids did better, or were at least stable, even when they were maybe going into the pandemic with some clinical levels of anxiety. Kids struggling with depression may have done less well, but then you go back out into the world and say you are struggling with social anxieties, where being at home safe with your family feels great, but then you have to get back to school. So, I think there's so much nuance to thinking about how we're doing. We're struggling, or we're thriving, and I think this notion of mental health not being the absence of emotional discomfort is really important to think about. So that while, yes, the pandemic was a society-wide trauma, and we do overuse that word, but I think it's maybe fair in this context, it really depends, to take that to kind of create a story of we're traumatized, there's nothing we can do, we're not empowered to change or to adapt. I think that's a mistake as well. So I think this nuance is really, really important to consider.
And you mentioned something, Regina, about the impact not being equivalent and use socioeconomic status of different countries, where there are also different impacts depending upon the age. So looking at children, adolescents, teens, going on into geriatric populations, or was it a more nuanced answer?
So that's also complex, because we have been seeing, so during the pandemic, we saw increases in visits to the emergency room for suicidal ideation, suicidal thoughts, suicidal behavior, not suicidal self-harm. But that was also already increasing before the pandemic. So I started doing research in suicide in around 2005. And the year before is when we nationally in the US were seeing increases in youth suicide for the first time after a decline. And those suicide rates had been continuing to rise. And so it's hard to tell whether the pandemic, how much of an impact the pandemic had, because I think what the pandemic did was, and I could be completely wrong, it made us more attentive. I like to call it a collective stressor rather than a trauma. I like to call it
I like
collective
that better.
stressor. So we've all been experiencing the impacts of the pandemic in some way. And so it made us more attentive to mental health and our functioning, our emotional functioning. And so I think when we talk about our collective mental health being exacerbated, part of it is that we're more attentive to things that were already happening, including with our kids.
Yeah, and I would like to add that in many of these large studies, they use very strict ways of measuring mental health. They might use, for example, diagnosis, and meeting criteria for a diagnosis is something that you really need to be struggling to meet criteria for a diagnosis. So they might miss like an overall global response to this, how do you call it?
Collective stress.
Collective stress. So it might be that we are all, not all, but I think we are still processing what just has happened. And we need to give ourselves some break and let us be as how we are feeling right now. It might be not, again, this is all, processing these stressors is also part of having mental health. So it might not be at the level of diagnosis, but there might be people that are still struggling with, I don't want to say mental health, yeah, but worse mental health than before without necessarily meaning that they meet criteria for a diagnosis. So in those studies, probably they will not be among the ones that are meeting criteria for the diagnosis, but maybe we have that feeling that we are not as feeling as how we were feeling before, but I think we are still in the process of processing everything that has happened.
Measurement is such an important point, because the ways that we ask people how they're feeling are so variable, and sometimes it's diagnoses, but sometimes it's how anxious are you? And right now I think we have this language of anxiety, especially of anxiety, but also depression, sadness, where we equate anxiety with an anxiety disorder automatically. So that as soon as we say, I'm anxious, we assume pathology. But the truth is, the emotion of anxiety is not pathological at all. It's an emotion we evolved to have. So if we're asking young people who I think have learned this language of despair and dysfunction around difficult feelings, if we ask them, how are you feeling? And they say, I'm feeling anxious, we're inferring a lot from that. And we really don't ask perhaps as much. We're so bent on finding pathology, right? Finding problems. Sometimes we don't ask enough about grit and resilience and positive perspective. So I think measurement is such a filter on the reality of what our daily lives are all about.
And we also are measuring things with instruments that were developed for mostly white population. So we might be also missing the expression of mental health problems that might be different depending on the cultural background of the people. So we are just using, this more Occidental or white, or I don't know, but those instruments have been mostly validated and designed among that population. So now the field is moving towards making these instruments more culturally sensitive, which might switch the results of the things that we are seeing.
Yeah, I'd also like to add something and just highlight something that you alluded to, Ana, and that you actually said to me yesterday, which is, yes, so are we more anxious because of the pandemic? Yeah, that would be an adaptive response to a global pandemic, is to be more anxious and to feel stress. And so we still have to process all of that. And it's okay. It's okay that I think you said this, it's okay not to be okay.
And I think here's a good point, too, to make a distinction between anxiety and an anxiety disorder. And of course, we can talk about all of our difficult emotions and sort of the clinical distinctions. But with an anxiety disorder, you could be anxious every day, quite anxious. So say I struggle with social anxieties, for example. I don't like speaking in front of people. I fear the judgment of others. I feel nervous around others or performance situations. Now, I could really struggle with that every day, but I won't be given a diagnosis of social anxiety disorder unless the ways I'm coping with those anxieties are disrupting my ability to live my life, to live, to love, to be productive, to connect with others. So if I stop going to work because of the social anxieties, if I turn down interesting speaking opportunities, if I, cut off from my friends, that's the point at which a diagnosis might be helpful. Because what's happened is there's this habit of disconnecting and avoiding from these experiences that's actually causing more harm than good. It's causing more suffering. And so the suffering itself, which stinks, is not the pathology. That's the messy work of being human.
We need a nasal swab test for anxiety.
We all have anxiety. So when someone says, I'm anxious, I say, good, me too, because we're all born with anxiety. It's a normal emotion.
Right. So you touched on something, Regina. You said, you started studying suicide in 2005 and been seeing this increase. And as I said to you in preparation for this, the New York Times just had an article earlier this week that, suicides in Caucasian populations have been relatively stable the last couple of years. And to Anna's point, that the suicide rates in Hispanic and Black ethnic groups have been increasing quite significantly in the last 2 or 3 years. Is that pandemic related? Is that just better statistical keeping, or is there something else going on there?
I don't know. We don't know if it's pandemic related. I don't think that we will ever really know. They were already on the rise among those groups. So in 2018, I think, or 28. So we reached about 48,000 or so deaths per year by suicide, and then that dipped in 2019 and dipped in 2020, has started to go up, went up in 2021 to about close to 47,000, I think, but still hasn't reached that height that we had around 2018. But what we've seen between 2018 and 2021, which is where we have data, for white people, that the number has stayed relatively stable. It has gone up for indigenous people, particularly young adults, but indigenous groups tend to have the highest rates of suicide in the U.S. Per capita. And it has increased among Black teenagers and young adults, among Hispanic young adults, has stayed about the same among Asian people, And I believe among Pacific Islanders has gone up among young adults, but the numbers are still low. And then there are other groups where we've seen increases like preteens, but those increases aren't considered statistically significant because those numbers tend to be pretty low overall. But we have seen increases in the past years in suicides among, correct me if I'm wrong, Anna, Hispanic, Black, and Indigenous children under the age of 12. But because there aren't enough numbers, they don't reach statistical significance. But if you look at rates over a decade, you see increases. And so the question is, why is it pandemic related? I wish that there were an answer. Like when people say, why are suicides increasing among teenagers? Our answer in our hearts is, I don't know. I don't know. Or like the real, not in our hearts, but like the real answer that we're telling, we don't really know. But there are some theories that there are things that people think might be happening. When we talk about communities of color, there tends to be lower access to mental health treatment, so there's lower treatment access, and that impacts risk. There's also a complicated relationship with institutions, including law enforcement, which tends to be involved in mental health visits. And so we don't know enough, and we don't have enough data or research on what the impact of people of color's interactions with our institutions, including mental health systems of care, and what that does to the probability of those who are at risk, disclosing that they're thinking about suicide and attempting suicide in the future. There are, the impacts of racism. So there have been a few, I believe, systematic reviews or meta-analyses, some reviews that have synthesized data suggesting a relationship between racism and racial discrimination and suicidal thoughts or behavior, but that's still very preliminary work relative to looking at other factors. We also don't know enough about the impact of the acculturation process and people's immigration experiences. So anecdotally, we study in our lab teenagers who come to the emergency room, and many of them are Hispanic or Latinx from the Bronx, and report traumatic experiences around having come to the United States, the impact of housing insecurity and poverty, living in shelters, sleeping on the subway. Some of our teens are sleeping on the subway. And also the impact of acculturating. So the data on, sorry, I'm going on really long, I apologize. The research on the acculturation process, which has to do with, adapting to the norms of American, US culture. So the data on suicide are mixed, but we know from mental health data broadly that acculturating is actually not great for mental health because you're removing ties from your culture of origin that might be a buffer. So there's some data suggesting acculturation, low acculturation might be bad for mental health, some data suggesting that acculturation worsens your mental health. And so I think that we still need to study those things further. So there are things that coming from a particular culture that are actually buffers against suicide that I think we remove when we kind of force people to acculturate in order to advance. And those things are understudied and that we need to study further.
That leads to a follow-up question. A lot of this we're talking about what's happening here in the US. If we were to look at mental health issues, anxiety, or suicide rates, are those relatively similar in different countries, or do they vary? If we looked in Canada for similar socioeconomic versus in less wealthy countries, do you see differences in incidence rates?
So one difference with the US is that our gun laws, which impact suicide rates. And so before the pandemic, in higher income countries, we were seeing declines in suicide rates, but not in the US. We were seeing increases in suicide rates, and that tends to be attributed to our gun laws because that's the primary form, firearms is a primary form of suicide death. However, sorry?
In the US.
In the US, sorry. in the US. Over 2/3 of suicides worldwide are in low to middle income countries, and those are understudied, very understudied. So the majority of worldwide suicides are in low to middle income countries. Sorry, I'll let Anna. Go ahead, Anna. Sorry.
No, I just want to clarify that the guns are the main cause of death in the US, but not in Europe. In Europe, hanging is one of the, or suffocation is the main method of death, dying by suicide.
When it comes to other mental health conditions, and I'm thinking more in terms of my focus, which is anxiety disorders and also depression, we see rates of these disorders having been steadily rising over the past 20 years. I think the best data that I've seen really across the world, particularly anxiety disorders, and some of that might be reporting bias, some of that might be meaning we're more aware and people are more ready to acknowledge these vulnerable feelings and emotions. But I also think that this is a very, this period of time and the past 10 or 20 years, it's been a time of rapid change, of economic instability. Here in the US, I mean, I'm a Gen Xer. I grew up with a tenuous hold on the American dream. I kind of believed that if I worked hard and I could do what I needed to do. But I think kids today don't really believe that. Maybe it's not completely a fairy tale, but I don't think they believe the chapter and verse story that older people were told. So there's there's a bit of despair, I think, more than maybe in other periods, and there's uncertainty. The pandemic was literally a pandemic of uncertainty as well as of this virus. And when it comes to uncertainty, anxiety actually is not about fear and threat. It's actually about future uncertainty. So I think there's a lot conspiring, not just in the US, but across the world, that really has pushed us to express our distress in terms of the language of anxiety.
Josh, are you going to ask us about social media? Because I'd love to have that.
That was
I'd like to have that conversation.
Yeah. So, of course, as a parent, we blame all bad things on phones and social media, and I wonder how far that is from the truth, or are there some benefits that they can gain through these kind of interactions?
I'll start. In the bit of work I've done in this space, and we do get pulled into black and white thinking about technology. And I'm a parent. I have a 14-year-old and an 11-year-old, so I'm right in that sweet spot right now. I think it is an oversimplification to just lay all of our problems at the foot of the mobile devices. I do think they're amplifiers for most things. So whatever you bring to this device, to this online interaction, it will be amplified, that's for sure. A lot of people very rightfully point to all the social comparison that happens on social media, especially among kids. And girls, we know, are more vulnerable to the negative effects of social media. But it really depends what you're doing on social media. So to say, and clearly the solution is not to completely get off screens, although there's time we should be off screens, because that's not realistic, right? So what I actually am more concerned when it comes to our digital lives is the commoditization of our personalities. That we have become brands, and kids very much have been raised to learn to value themselves based on these metrics that are very brand-like. Like they curate their self-image, they're tracking the likes and the follows and the reshares, and these are very poor metrics upon which to build a sense of self. And I think what it does is it cuts kids off from going deep, keeps them on the shallow, it keeps them from exploring all the complexity and messy work of developing a self. And I think it creates in them a sense of disempowerment in many cases. So I think there are lots of problems with phones and devices and social media, but I think, again, there's a lot of nuance here. And we can also teach our kids and ourselves to become digital citizens that take responsibility, see where the system is kind of designed against us, because it's very rigorously designed to hook us in and to have us compulsively pick up these devices and use these screens. So we have to become healthy digital citizens and be very deliberative and thoughtful about how we do that and help our kids do the same.
You guys have any thoughts? You can do it in the form of a TikTok.
I will say that something that social media or the use of the phones might impact in a way that it might be impacting us is that we we are losing the capacity of waiting without having the phone in our hands, of doing something, just been sitting there and wait. So for us, that we have phones since kind of recently, when our capacity of waiting has been already developed, and now kind of is going backwards. But for children, I think this immediate, they are stimulated all the time through the phones. If they need answers, they look for the answers on the phone. And they are not, it could be that they are not developing the capacity of delayed gratification. So when they have to deal with something that might happen in the long term, it might be harder for them to wait because they don't know how to do it. They have not developed the skills for waiting, and it could be in part because of the use of the phones. For example, they can just, they are watching cartoons and then they can just stop that cartoon and start another one, like they don't even finish the cartoons that they are watching and they are just switching to the next one. Is this content, because it's getting bored, this part, so I switch. So they are not learning to sit with discomfort because they can just switch to something else. And that might have an impact on the way that they handle larger problems where they need to use their skills and social media cannot, or the phones cannot solve those problems.
I agree. I think that social media pulls for surface level interactions. It's very difficult to have deep interactions on social media. I mean, that being said, there are some cases where people who don't have community, maybe if you're part of a marginalized group, you live in the part of the country where you don't have community, social media can be a way of accessing community. But I think that, so I'm not a social media expert. I'm an expert user, but not an expert researcher in social media. Semi-expert user. My working theory is that, so it's not that social media itself has changed, has impacted our mental health, it's what it means about how we interact with each other in other ways. So in order to resolve conflicts, in order to notice whether someone is struggling, you really have to invest the time, the one-on-one time. And so social media can be a distraction against having to sit with that discomfort that it would take to, say, have a conversation with someone face-to-face or on the phone, and to sit with our own emotions and process them because we have a ready distraction. It also pulls, because it pulls for surface-level interaction, it's very difficult to be your true authentic self. Generally, I mean, it's very difficult in general to be our true authentic selves because there's a lot that pulls for us to not be ourselves. But social media does that even more because you present a snapshot of your life that's not your full, authentic life. And so I think that interferes with some opportunities that we might have to really have that one-on-one contact and investment. And also with the digital revolution, and I don't know if we're going to talk, we'll get to this, right, in mental health, like using technology to improve our mental health outcomes, to increase access to mental health, to treatments, right, which is very laudable. However, we tend to look for easy fixes, right? So kind of like when you're feeling bad, let's go to the phone as a distraction. It's an easy fix. When we can't figure out how to increase access, or when the personal investment that it takes to figure out how to help people that we're having trouble helping, when that gets to be too much, we look towards a solution that it gives us an easy out. And I'm not anti-technology, and I think that there are very good uses for technology in improving treatment and access. But I do worry that we tend to, our attention shifts, and we tend to look for, when this problem is hard to tackle in this way, which is like the more in-person, face-to-face personal investment, we shift all of our energies onto what seems to be an easier solution. And we can be doing multiple things at once, right? We can be using technology to further a society and further, improve mental health outcomes, while at the same time figuring out the messy part of being human and having relationships and being there for each other.
Yeah, I think we don't think enough about what technology is actually good at, because it's so ubiquitous, so we use it. So it's really good at bridging, at just making superficial connections. It's not good for bonding, for deep connections. And I think that when we can start making those distinctions, we will make much better choices about the role of technology in our lives.
Well, one way technology is really changing the way we do things is at work. Prior to the pandemic, almost all work was done in person, and now some companies are completely remote, some are in this weird liminal space right now. Has that kind of loss of collective being in one place impacted mental health?
Yeah, I mean, the truth is that when you look at the stats on loneliness, we are lonelier than we've ever been, yet we're more connected. So I think that disconnection is really affecting our work life. A colleague was just telling me he had developed an app in which he's asking people about their moods and tracking them. And he's gotten there's 1 million users of this app. And he said the most dominant emotion expressed, even though it's not totally an emotion, is tired, is sort of sapped of energy. And I think that, I think we've all experienced, if we live in a hybrid work environment, that energy we get from actually being with other human beings in a real face-to-face way, I think it's really having a deep impact on us all.
Yeah, and I think that so now when you are working from home, you work all the time. I even myself eat in front of the computer, but
Really, Anna? I don't do that at all.
I know, this is
Just
a
you.
cultural shift for me. But at work, when I had people around me, we were stopping for jokes and look at this video in social media, or let's grab lunch together, or even walk for coffee outside. Like, we were doing other things that is not working all the time. So by the time that is like 5, 6, when you stop working, you are exhausted because you have not had a break in the entire time. And even when you are officially stop working, since you are completely connected to work because the computer is there, maybe the email is open, if not, it's open in your phone, it's hard to, I think that we need to do like a real conscious effort of closing everything. I'm done working, let's put everything aside and just, enjoy the evening without thinking about work, because if not, we are constantly, in some way working. Like in the back of our minds, we are still working, and that's exhausting.
And if you think about it, they've designed these giant rabbit holes that they've placed all in. I mean, the technology companies, but they're just designed to suck us in these ways. And it's a new experience from a historical perspective. And it's like we really have to be aware of what's being done in the design of these tools, and how to take back control so that we're using technology instead of it using us all the time.
So have we reached a tipping point? Using an analogy to say climate, they say if we don't stop the climate increasing by 1.5 degrees centigrade, the world is going to go kablooey. Are we approaching that kind of crisis point with mental health, or are there things that we can kind of turn the tide and do to try to improve not only our own mental health and well-being, but more society in general?
Stop eating in front of your computer.
Stop eating in front of your
computer. No, and so one of the things is making a space, like different space between this is a space for work, or mental space, physical space, time for work, and this is time for myself and for doing something else. So I became aware of that, and I'm actively making a space for like eating just like in a different room as a way to keep me away from the computer, and actually feels good. When I go back to the computer, you feel less tired.
I think so for me, I come from a faith background that, and it's kind of this refrain I've had in my head where we talk about bearing each other's burdens. And so when somebody's struggling, I think there's still a push towards not being open about it because we want to try to fix it. We see it as a problem that needs to be fixed rather than a burden to be borne together. And we tend to look for the solution in changing the way that the individual thinks, so that you could change how the individual feels, or taking medication to feel better. But we don't look at our collective responsibility to help each other's to have an impact on each other's mental health functioning. So we tend to, when we measure things like emotion regulation, we measure it like, how does the individual manage their emotions? But how do we learn to navigate our emotions? It's like through our early relationships. And so we don't really talk about those dyadic systems or cultural systems, right, that impact our mental health functioning. And so, and I've been thinking about this a lot with respect to suicide, because we spin our wheels and spin our wheels and spin our wheels and try to look at risk factors and protective factors and treatments, and we still seem to be in the same place. And so we can't just put the burden of our mental health on providers, on treatment providers. There aren't enough, first of all. And the way that we've developed our treatments only serve certain people in the most idealized, like it's a curated way of testing these treatments on people who meet certain criteria, and we have exclusion criteria in our clinical trials. And so we're not actually developing treatments to treat the people that are actually coming for treatment. So that's one. And then we're not serving, we're still in our early stages in developing culturally informed and tailored interventions. So we just don't have the supply to meet the demand. And so we need to do other things. And so what I've been thinking a lot about is what is our collective responsibility to be present for each other when we're struggling, and to allow each other to be honest about our struggles, and to not, because I think about this, and we've joked before about, what's the easiest conversation stopper at dinner. It's like, what do you do for a living? I study suicide. Like, oh, that's intense. But no, like it's not, 1 in 5 kids think about suicide. It's not intense. It's not this, it shouldn't be this taboo thing. So if we could allow ourselves to be who we are, I mean, that sounds a little bit like kumbaya, I don't know, whatever, hippie. But like really to be our full authentic selves and to accommodate to that, I think that we'd be better off.
Let's agree we're not at a tipping point, to your to your metaphor or whatever that would have been. So I think we are in a moment of incredible opportunity when it comes to mental health. I think we're talking about it more than ever before. I think what we're talking about is sometimes good, sometimes it's not helpful. Because I think a lot of our story of mental health is that we're vulnerable, that we're broken, that when we struggle, that it's all or none, as Ana was saying, like you have mental health or you don't. It's perfection, and it doesn't involve struggle, but that's false. But I think there's an opportunity to have these conversations because people are allowing themselves to be uncomfortable and vulnerable. It's okay not to be okay. That's the mantra now. So there's an opportunity. Dr. Vivek Murthy, who's our U.S. Surgeon General, and he was actually, this is his second time, he was in the Obama administration as well. When he was the Surgeon General the first time, he called out loneliness as his key public health crisis that he was interested in, not mental health, public health. He's the nation's doctor. And now he's calling out youth mental health as the crisis, as the health crisis. So not only is that telling us that mental health is health, but it's for those two crises we're experiencing, I think there's something very telling. And one, I think it's really echoing to what Dr. Miranda was saying, which is that there's something in our connection right now, our social connection, what we provide for our kids that is not working. And so when I think of solutions, I do go very deeply into this notion that when we build mental health, what do we need? We need people, we need a sense of place in the world, of meaning, and we need purpose. And kids don't have a strong sense of that these days, I think, because they're cut off from community in ways that are harmful in some cases. There's not enough awareness of unique and diverse kinds of community and to feel a part of something when your particular background is not accepted. I think we're making great strides, and those are very encouraging conversations. But I think we have to get back to basics when it comes back to mental health. I think we also have to understand that mental health is not this destination of perfection where the self-help industrial complex has told us there's 100 items on the self-help checklist, and if we don't check off 100 out of 100, we're broken. And that's just not right. So I think our conversations have to change. I think our community has to change. And I think purpose is also about not just thinking about community supporting you, but you supporting others and teaching our kids that actually giving back to others is an incredible way to achieve a greater sense of well-being.
And something else that the kids from these days are exposed that they have never been exposed before is the news. I think that through social media they are exposed to negative or dramatic news or negative news more than before. So that might go to the point that they don't see, like they perceive the society as all of these bad things are happening. So that might also impact how they see their own future, because it's just one, so they are exposed to murder, they are exposed to catastrophe, so all of those things might also be impacting them, and probably something that parents could do is, because they are exposed to these things, it would be great if you can talk to them about these things, because parents, as a way to protect them from the world, they might also avoid having these conversations. We don't know how to talk about kids about these things. It might be awkward. I don't know what to say, but at least using any opportunity, any song that might talk about something dramatic, something in the news that the kids might be watching. What do you think about that? Do you talk about this with your friends? What do they say about these things? What do you think? What do you say about these things? But start having conversations and giving them context, because they don't understand what is going on, and they might have more catastrophic thinking if we as an adult, we are not giving them the context to understand these things and put them in perspective.
You know, I also think, just to briefly say, and I just did it too, like these poor, vulnerable young people, these maligned millennials and Gen Z, I actually think they're powerhouses. I think they have the best chance of fixing what's going on than any of us, because they are vulnerable to all these things we're talking about, but they also are incredibly empowered, they're savvy, they're smart. So I do want to just add that to this, because we mental health professionals, we tend to go to the, we just kind of, it's just so easy, but I just think there's so much resilience all around us and so much potential.
I think so too. I'm curious, when we talk about things like the impact of social media on our kids, we think about it from our own perspectives. Like, I'm a Gen Zer, and I didn't have a cell phone until I was in graduate school. I think after 9/11, I got my first cell phone. And so how much technology has evolved. And our kids are growing up with it. They may be using it in adaptive ways that we don't understand, because that's not how we connect. But who knows? Maybe there will be some ways that they use it that will be, they'll solve it. They'll solve the problem.
Well, that's good on a hopeful note, and I hope someone in the audience will overcome their social anxiety and walk up to one of the microphones and ask our panel a question that might be burning in their minds. Yeah, come on right up, just so the people listening on the live stream can hear the question.
Is it on? Yeah. My question is pertaining to what you're saying about mental health and the news. For me, specifically, one of the big news stories has obviously been the war in Ukraine. And one of my kind of conflicts is wanting to be informed about what's happening, but also not waking up to this sense of doom about what's happening around us. Specifically with things like Twitter, I've noticed the way that the algorithms work. If I interact with a piece that says town bombed in Ukraine, I'm then going to receive tons and tons of information that keeps giving me that news. And obviously, it's a sad story, and of course, it's going to make you feel sad, but it can also become consuming. And I guess my question to the panel is, do they have any practical advice on how to kind of balance that, you know, being in the know, but also not being overexposed? Because you said it was a problem for young people, but I think it's kind of a problem for all of us as well.
Yeah, so it's for young people and also for us. I totally agree that now we are all exposed to more negative the news, so we know more details about them. We know exactly minute by the minute how the war is going. We are all exposed to those things more than before. But we can kind of think it. I was just making the point that the way that we were raised was not exposed to all of those things, while our kids are being raised with the technology in their hands and being exposed to all of those things. And I think this is one of the holes that you were mentioning before, like they design these holes where you get into one of these holes and you click on this thing and it sucks you.
And I mean, the awareness, you're kind of halfway there. And the way that all screens operate is there are opportunity costs for other things. So one thing to ask yourself as you're doom scrolling and you're going down that rabbit hole, or any of us can ask ourselves, what's our motivation here? What pain point are we addressing? Are we lonely? Do we feel we need to learn more? Are we bored? And once you figure out what that pain point is, you can actually make a plan to meet those needs off screens. And for me, also knowing the moments when I'm most vulnerable, right before bed. That's for me. Like when I wake up, I can stay off, but it's right before bed. So because you're already an aware digital citizen, you can start to see those design flaws in how this device has made its way into your life. And also, really importantly, look in and say, okay, what needs can I get met in other ways in the real world, or face-to-face, or through other modalities? And I think that can help.
Thank you. Yeah.
Thank you for your question.
Anyone else? Please, sir.
I find the word collective to be very problematic, and I'm actually surprised that none of you have mentioned it or discussed it, because America is a land of diversity, and collective kind of implies a consensus type of thinking. And I almost think it's like a dangerous word, collective mental health. I don't know what that means. Perhaps you could discuss that.
We didn't come up with the title of the panel. But I think what it's about is that we have mental health in context and community. I understand what you're actually pointing to nuance that I think is lost in what we were thinking about.
The reason I'm bringing it up is I lived and I taught in China for a while, and there was collective mental health there. I thought they were nuts. I did. And I realized that if you control the media, you control the people, and the people, they all had a collective way of thinking, which I said, this could be very good, but it could be very dangerous also. And I see the word collective mental health there, and I'm saying, how did that word sneak in there?
Yeah, can you, what's a better word? Can you help us with our next title to come up with a word that gets, with more nuance about kind of us together in society, in context, experiencing mental health?
I was hoping that, what is, if you live, is there a collective mental health definition? And I find that, if this was 1930 Germany, collective mental health would be anti-Semitism is very healthy. Or if it was 19th century America, collective health is to see African Americans as inferior and Native Americans as savage. That is collective mental health. So I'm like saying, wait a second, what is collective mental health? What if somebody is living outside of that? That doesn't mean they're mentally disturbed. It means they don't go with the majority or the consensus.
Sir, as you probably inferred from our perspectives, I think we are not adhering to that definition of collective mental health, but I think it's a really important point you raise.
No, the word just keeps jumping out at me.
Yeah.
I'm like saying...
And I think I used the term collective stressor in reference to the pandemic, and that just meant that we're all in the pandemic. Everybody's experiencing the impacts of the pandemic in some way. I think, right? Yeah?
Yeah, I mean, in some ways we're talking about societal instead of collective, and then
Yes,
it's everyone, an inclusive societal.
Thank you.
All right, well, and then Karen, we should especially thank Karen with the last question, as Karen organizes all of our public events. So thank you, Karen.
You're welcome. And it's great to have such a wonderful audience here. You mentioned about technology being a really key new way to help spread mental health treatments. And I'm wondering if you could talk about, what do you see as the future? Like, what are ways that we're not even thinking about now, or not that you guys are thinking about, but not our society really knows about in terms of really addressing our mental health issues? What's on the horizon, and what is it that we should be advocating for?
I think that technology is very good for some things and digital technology is very good for some things and not for others. I'm very excited about the potential of digital therapeutics where interventions are accessed through, digital means. But I'm really excited about the ones that are actually optimized for our screens, things that are brief, micro-interventions, so we're on and off the screens, we're not sucked into it more. Accessing teletherapy when we just don't have a therapist within driving range of us. So, I think 90 million Americans, probably more at this stage, live in these healthcare deserts where they would have to drive more than 5 or 6 hours to get to a healthcare professional. So I'm excited about that. I'm excited about brief interventions because a lot of them are very targeted, and one of a leader in the anxiety and CBT world, cognitive behavioral therapy world, Al Kasdan, who was really a founder of a lot of great science on cognitive behavioral therapy. He said once at a conference that he founded, like a bazillion years ago, he said, if we really wanted to help people, we'd get them all to exercise. And I mean, help their mental health. And then we'd see what was left over. And we'd develop boutique treatments that really helped people with these targeted challenges. And we make them highly accessible, we make them cheap, we make them easy to use. And so for me, I'm excited about actually not just trying to put everything on screens, but really refining and personalizing how we're using these tools to do that kind of very targeted mental health intervention, including mindset interventions, which are, yes, we do need to change environments and social systems. But I also think a bottleneck right now in our mental health is that we don't believe that mental health is possible for us. We feel broken, we don't feel optimistic, and mindset interventions can help loosen up those pessimistic assumptions and actually open us up to benefiting from treatments that we actually can avail ourselves of.
All right. Do you want to say something, Anna, or
Yeah, another area of research that is happening right now with also social media is that it has a name. So they are developing algorithms that they can follow what people are writing in social media. So when they detect specific keywords, they can alert that this person might be becoming, more depressed than before. So they are using those texts to identify someone that can be at risk for. It can be suicide. It can
Passive monitoring?
So one is with passive monitoring, that is just getting data from the phone and detecting if someone has stopped sending text for long periods of time or is not moving for long periods of time. But the other one is that they actually get the information from the text. No, I don't think that is your text, but at least Facebook, like public sources, and then they analyze the text of those outlets, and then they can identify specific words that might be indicating that there's a change in mood in that person. This is another line of research.
I will admit that I'm skeptical, and makes me feel old to say that I'm skeptical of technology, digital interventions. I think for problems that lend themselves to micro-interventions, that you just need that. So for example, in the area of suicide, right, we know from the limited data we have that it's for someone who attempts suicide, it's a short period of time between when they make that decision and when they attempt, so it's 10 minutes. So if you can have some kind of intervention that would move the needle one way or the other in that small period of time when they're by themselves and there's not any room for intervention, I think that could be helpful. But I think that a lot of things are more complicated than that. And I also think that there is room, with things like passive monitoring, for example, room for identifying someone as being at risk and then intervening in a way that is ultimately not helpful to them within our existing systems of care. So for example, calling 911 on someone who has a negative interaction. And there are conversations around trying to not have law enforcement involved with suicidal individuals. But intervening in a way that leads to a negative interaction, say with law enforcement, that then leads the person to be less likely to disclose their suicidal thoughts in the future. So if there's a false positive, the potential impact of that false positive on future outcomes for that person. So just, we really need to think through and be responsible about what all of this means. That being said, I'm open to being completely wrong, and I hope that in 20 years, I'll be the old, have been the old fogey who was skeptical and was completely wrong. I mean, ChatGPT can write our papers now, so I don't know. You never know. You never know.
On that hopeful note, please join me on thanking Dr. Miranda, Dr. Peralta, and Dr. Dennis-Tiwary for a fascinating discussion. Hopefully, you've learned a few things about mental health and what we can do to help ourselves. And if you're interested in exploring more about science and the City of Science, I invite you to join us on May 10th, where we're going to be looking at how climate change is impacting our health. Until then, I wish you a very good start of the spring season. Thank you and good night.